our study is a comparative study, which is done in Qatargas Medical Department. We were measuring the impact of effective fitness to work programs on reduction of offshore medical evacuations. I'm representing the medical department of Qatargas, Dr. Mohammed Al-Naimi, the medical manager, Dr. Walid Hassanen, doctor in charge,
Yes.
doctor in charge for the medical occupational health in our company. The background of our presentation, we have a significant number of offshore operations that are carried out in Qatargas by Qatargas employees and contractors in multiple offshore locations. Hence, people acutely ill requires costly and risky medical evacuations. We call it the Medivac, as you are aware, undertaken by helicopter or boat. This study aimed to evaluate the impact of offshore fitness to work program on reducing the number of preventable Medivacs in Qatargas compared with other oil and gas offshore organizations. The method case presentation. This is a retrospective review of Medivac data between the years of 2018 and 2020 in Qatargas offshore locations in relation to the total yearly population. Employees records human resource data and medical screening data were used as a denominator for that population. It included analysis of pre-employment medical examination, periodic medical examination, medical screening programs, and occupational vaccination and fitness to return to work programs. For that perspective, that in Qatargas, we have plenty of fitness to work programs. As just mentioned now, we have the pre-employment medical examination, which is a medical test conducted to any worker before joining the work in Qatargas. We conduct this medical screening according to our requirements. We have also the periodic medical examination, which is conducted for all Qatargas employees working on our fields. We have that conducted in either annually over the age of 45. Every year, all employees, mandatory, they are going for medical assessment, a comprehensive medical examination, and every 2 years for those below the age of 45. In addition to that, we have also the medical screening program. This is conducted for our contractors. Those are going to work in all fields. Let's focus here on the offshore location. We are conducting this medical screening for all contractors going to work in our locations. In addition to that, we have also our occupational vaccination program. This occupational vaccination program is, we have those like mass vaccination, like COVID-19, which is applied for all offshore workers. In addition to that, before even the COVID-19, we have that also mass vaccination or at least history of infection with measles and mumps. If no history of vaccination, no history of infection, then we apply the vaccination. This is applicable for all as well. We said like the Qatargas direct hire employees, fixed employees, and contractors. Those are going to work in offshore in order to limit any communicable disease spread in our offshore locations. Same as well, we have a specialized vaccination program, which is applied, let's say, for as an example, for the food handlers. We have like in addition to the COVID-19, measles, the mumps, we add typhoid vaccination as one of the requirements. In addition also to that, those are working in sewage disposal. We have the hepatitis B vaccinations. All of these programs aiming to reduce the number of medical incidents while they are being working in offshore. The offshore nature workplace, the nature of the workplace in the offshore, as you know, is a bit of higher danger level because they are away of medical or immediate medical emergency medical assistance. We have there our first aid stations, our nurses specialized in the field of occupational medicine and emergency response. However, if someone knows the nature of the offshore, we have a lot of wellheads, which is also scattered in many places in offshore. So to reach any worker there, it may take a bit of time with the helicopter, with the boat. So we try to minimize any incident to happen before it happens actually. In addition to that, we have also, I don't want to take much time in mentioning all of our fitness to work programs. We have fitness to return to work. Anyone had injury or incident or surgery or recovering from any illness, he have to come to the medical centers of Qatargas before resuming duty in offshore to make sure that he is fit to resume his duty in a safe manner. Adding to that, we had the medical fatigue assessment, fitness, like job transfer. Anyone will join the offshore location from onshore or from different workplace, he has to also come to the medical center to be evaluated by the medical department to ensure he is fit for the new assignment, which is in a remote location. So, because we have our disqualifying criteria to work in offshore, so before someone gets transferred of his job from onshore, let's say, to offshore location, he has to come for medical fitness to work assessment. So let's go back to the result of findings and recommendation of this study. During the 3 years period between 2018 and 2020, we had recorded 10 medivacs occurred in the total for a total of 13,376 workers. Over these 3 years, we had this number of workers, 13,376 workers, went to offshore, worked in our offshore locations. Over this number, over these 3 years, we have recorded only 10 medivacs, resulting in a rate of 0.74 medivac per 1,000 workers. We will see that in the figure one when we come to that part. This rate is remarkable compared with similar studies in other oil and gas company or offshore industries. You can find that also in the references. One was 4.97 per 1,000, while the other industry was 4 per 1,000. When we compare it with 0.74, this represents almost 7 to 8 fold more than the situation or the case in Qatargas offshore locations. In addition, we have evaluated retrospectively the medical records of medevac cases to identify those due to medical reasons, not injury and trauma. And we found out of the 10, also those ones, we have only 6 medical cases. So we have 4 traumas or injuries of needed medevac and only 6 medical cases. One worker had a pre-existing medical condition among these 6 cases. 5 without pre-existing medical condition, which here also opened the window for to even cases those have no pre-existing medical condition are still may exhibit or may show unexpected medical emergency while they are working in remote locations. Another finding was that the average age of the 3 medevac cases due to suspicious chest pain was 57 years old. All medevac were of male workers. No wonder most of offshore operations are male-dominant environment, mostly because of the illnesses, 60%, and trauma, as you mentioned, it was 40% for trauma. Conclusion of this study provide that this study provides a new benchmark of medevac rate, as I mentioned, 0.74 per 1,000. Aruba's business to work in offshore program with adequate implementation of other preventive measures like occupational vaccination program is effective in reducing the number of preventable medical medevac from offshore remote locations and hence reducing the cost of both medevacs and lost working hours. And offshore, of course, I'm sorry, of course, it's also saving a lot of lives. Here, this is just the figure one where we can just demonstrate the rate of the medevacs per in year of 2018. We have only 2 medevacs when we had 2,211 workers went to offshore for work, which is with the rate of 0.9 per 1,000. In 2019, we had 3 cases among 5,430 workers we are working in offshore, while in 2020 we had 5 cases of medevacs also among 5,735 workers went to work in offshore in our offshore location. This pie chart, as you can see, 40% of the cases, 4 cases were because of trauma. I mentioned that earlier. 4 cases of cardiac nature, okay, and 1 case was because of gastrointestinal symptoms, and the 1 case of because of communicable disease. Here are our references. You can find it here, which is oil and gas in United Kingdom, and Turner and Andrew Wilson. That was an work location, also another work location of another offshore work location. Unfortunately, we this field of or can say like making studies in this area are not much. We find that also it's a good area to improve it. That's why we decided to make a study about that, because we can find much industries applying a lot of studies, a lot of research about this point. However, I think it's an area that needs maybe more attention from all of industries to compare themselves, to compare performance of the fitness to work program with other similar industries in the same field, so they can benchmark their performance in that perspective. Thank